Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
What are the causes of maculopathy degeneration? That is macular degeneration. Macular degeneration can be of following types. Macular degeneration includes annular crescent. Actually, it is myopathic macular degeneration. That is, in a patient with myopic individuals, the macula or the fundus shows these findings. Right. In the myopic macular degeneration, there will be presence of, this is the optic disc. Sorry, this is the optic disc. Surrounding the optic disc, we see annular crescent will be seen surrounding the optic disc. Then you see lacunar cracks are seen here. Cracks will be seen due to choroidal neovascularization. Those cracks are called as lacunar cracks can be seen. All these can result in rhegmatogenous retinal detachment. There is Foster-Fuchs spots are seen in the macula. So this is macula. Here we see Foster-Fuchs spots are seen in the macula. Chorioretinal, these white areas are chorioretinal atrophy is seen especially in the posterior pole, with the macular holes are seen, and posterior staphyloma are seen in myopic individuals. That is, in pathological myopia, fundus changes are seen. These changes are seen.
thank you and thank you for watching.